Close to 800,000 people in the United States have a stroke each year. And when it comes to treatment, it's important to be fast. But what should one do to prevent a stroke? Carle's Lage joins me in this episode of Being Well to learn how you can make stroke prevention a priority in your life.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming a new guest to the show. Coming to us from Carle, we've got Lage. Welcome to our studio.
Thank you for having me.
Of course. As a new guest, I always love to give you the floor and let you share who you are, what you're certified in, and so take it away.
My name's Lage. I work at Carle Foundation Hospital as an advanced practice registered nurse in the neurology department. I have been in this role for 9 years.
Okay.
I did not always pick the neurosciences as my specialty, but wound up there because of vascular health. My strength was typically critical care and cardiovascular care, but when Carle came asking for me to consider them for employment, then stroke is a vascular disease. So I thought, well, maybe. And so I have been on the stroke team for 9 years now.
Wonderful. So it sounds like a pivot and you kind of landed where you're supposed to and helping people.
That's exactly how I look at it.
In that lane. Well, perfect. And so as we're talking about stroke prevention today, it's a very common condition. Can you talk a little bit about that just to open up?
Sure. So stroke happens, about 795,000 people have stroke each year, which I think is a really high number. And another high number is that 80%, according to the American Stroke Association Society, 80% of strokes are preventable, another high number. So stroke is the 5th leading cause of death. It is the leading cause of disability, which creates a huge cost all the way around. And even at the most minimal level of having stroke symptoms, stroke kind of gets in the way and can affect people and change their quality of life.
Yeah, so is a better place to start with what is a stroke or prevention?
Sure. As I mentioned, stroke is a vascular disease. It's all about the plumbing.
Okay.
87% of strokes are due to the plumbing getting blocked by either a clot or the blood vessel getting narrow to the extent that it's blocked itself off. And about 13% of strokes are because the plumbing has a leak. So the first type of stroke is called an ischemic stroke, or meaning lack of blood flow. And the other kind of stroke is hemorrhagic stroke. So when stroke happens and the blood flow is interrupted to the end point of the brain, then you develop a neurologic symptom that could be permanent, and brain cells die as a result.
And I hear people talk about a stroke and then also talk about a mini stroke. So is a mini stroke the same thing, just less severe?
I get this question a lot from my patients. A stroke is a stroke in my book, but it's a spectrum. You can have a stroke that causes very slight symptoms on one end of the spectrum, and you can have a stroke that kills you on the other end of the spectrum.
So as you're talking about it, it could be the difference maybe between the pipes being a little bit blocked or severely blocked, or a little leak or a big leak.
Or the area of the brain affected.
Gotcha.
For instance, in the brainstem, a small territory involved could create huge symptoms. Whereas I've had patients that have had silent strokes. They didn't realize they had a stroke. They had a symptom that came and went, which is still important to recognize for that reason, because a smaller stroke, meaning smaller in the way of symptom burden, could have happened, and we need to learn more about preventing yet another stroke.
And if I'm trying to do some detective work and relate one of those symptoms that maybe didn't quite seem like anything, what am I looking out for?
It's a great question. We use BFAST at Carle to recognize stroke symptoms. B stands for balance difficulty or coordination difficulty. Sometimes people find themselves missing items, trying to pick up items and missing them, and having coordination difficulty, or having difficulty walking, like they're leaning or listing to a direction. Well, that's weakness. E is for eyes. Stroke can take away vision. It can take away vision on one side of your vision or the other, or it can cause double vision. F is for facial droop. A is for arm or leg weakness or numbness. And S is for speech difficulties. Sometimes people can say all of the right words, but they're slurring them together. They're not articulating their speech. And sometimes people are saying a whole lot of words that make no sense. Those are two different kinds of stroke. T is twofold. So T can be for terrible headache. If someone is saying they have the worst headache of their life, that's cause for concern, and most especially if it's accompanied by one of those neurologic symptoms encompassed in BFAST.
Okay.
T is also for time to call 911. It is imperative to get to emergency care as soon as possible to get the best stroke care available.
And I'm sorry if I'm ignorant to it, but I feel like I used to always hear fast. Is the B part newer?
So because strokes were missed, the fast, face, arm, speech, time to call 911 kind of rattles right off the tongue. But then if someone comes in and they're like, I feel like something, in this true case, I feel like something isn't right, and you don't check their vision and notice that they've lost half their world, you've missed a stroke.
Yeah.
So B for balance, E for eyes, and vision loss or double vision.
And a lot of these things, I mean, they can masquerade under a one-off type of thing. So at what point, what kind of repetition should I be like, hey, maybe this is cause for concern and I should see my doctor?
I'm not so sure that repetition would be great advice, because we as humans, we try to push through symptoms sometimes and wait for them to get better. A lot of patients I've had, they're like, I went to bed thinking I could sleep it off and feel better in the morning, and symptoms were worse in the morning, and we've missed our opportunity, our window of opportunity to be able to treat them most effectively with what we have available. So that BFAST is a succinct list of discrete symptoms that you can look to if you're considering or concerned about stroke. And if you have any of those, or if you're with someone that has any of those, that's cause for concern, and you or they need to get checked out.
And so when you call 911, they can obviously give you some sort of guidance as to whether this is likely serious, get to the ER, versus I think you're okay treating this with the ibuprofen or whatever it is.
They sure can. So it's the same as if you were to call and say, I think I'm having a heart attack, I'm having chest pain. I think I'm having a stroke should get the same attention, and they can start talking you through what to do, next steps, and who's showing up when to bring you to the closest facility.
Are there different maybe sort of procedures or things you can do if you are with someone versus if you are alone? I mean, I'm sure that's a scary thing to try to process.
I had someone ask me recently if they would be able to contact someone if they were by themselves. That's a scary thought.
Yeah.
Actually, when people are having stroke, they're quite often very intact with their thoughts. It's just that they've lost something. They've lost use of one side of the body or the other. They've lost vision. They might not be able to get words out correctly, but they can still know enough and do enough to be able to call 911. So I kind of reiterate that even if someone cannot speak, that to everyone else may look like confusion. If someone is not, if they're mute, if they're saying words that don't make sense, then they'll say, oh, mom's confused. No, you ask them to repeat a simple sentence, the sky is blue. And if they don't say that sentence back to you, that is an emergency. That's a 911 call.
Gotcha. And that will be, that will stay true even if I have maybe a loved one who's already been diagnosed with, say, an Alzheimer's or something to that effect?
Of course.
Okay.
Yeah.
Gotcha. So let's maybe pivot a little bit to talk about the prevention side of things, because if they are so preventable, I'm sure folks would love to know what steps to take.
Well, one thing I also like to touch on in an emergency situation is that, you know, if you have someone with chest pain, you've heard or learned that you should give an aspirin. You should not do that with stroke, because you might be having the bleeding type of stroke, and that will in fact make it worse. Okay. The goal in prevention, for primary prevention, meaning that you haven't had a stroke, is to not get there in the first place. So to be cognizant of what your family history is, if there's vascular disease history in your family, to know about that. And stay in touch with your primary care provider, who will be watching for high blood pressure, high cholesterol, diabetes. These are all risk factors for stroke. It is the management of these risk factors for stroke that diminish risk for stroke. Then there's also lifestyle. Lifestyle changes can have a huge impact on reducing your risk for stroke. Smoking is not a good idea. Do not smoke. Don't overuse alcohol. Stay active. Try to lose weight and eat well. On the American Stroke Society website, there is a Life Simple 7, which is just a handy visual with including all of those things for a reminder.
Mm-hmm. Well, I tell you what, if there's any sort of common thread through the 4 seasons I've been hosting this, it's weird how diet and exercise can really add up to a lot of these conditions that can be preventable.
Affect everything.
Yes, and so they're all tied together. So and it doesn't have to be anything dramatic. I try to, really drill that point home, because there's a lot of folks who are saying, okay, well, I have to completely change my entire diet. I have to give up everything that I love. I have to go run 4 miles a day. And that's just not a sustainable way to try and have these lifestyle changes that can really add up to something big.
Correct. And you have to set achievable goals for yourself. Yeah. So when I have patients that are like, I'm not going to be able to eat the things that you like, whether it's maybe a couple pieces of bacon or a piece of chocolate, those are treats. They're not mainstays in your diet. And when we talk about quote unquote cardiac diet, it doesn't sound too interesting. So I like to lean towards a Mediterranean diet. And I think it's really fun to research what is on a Mediterranean diet. There's lean, healthy meats, there's colorful vegetables, some fruits, and there's just a whole lot of even different things that maybe you've never introduced to your diet and didn't know was out there. And then it gives you an opportunity to learn something new and get into the kitchen a little bit more.
Yeah. Every time I hear Mediterranean, I think of kind of the eating the rainbow. I feel like a lot of the vegetables that are, getting your colors in. Yep. I have in my notes here about a stroke workup. So what is the role of a stroke workup, and what is it?
Right. When a patient comes into the hospital and we are suspecting stroke, we should be able to, get enough of a history and examine the patient to come to that conclusion, and then be able to confirm it with imaging. Just by symptoms and stuff, we should be able to get on the good path of diagnosing a stroke. And we confirm that with imaging, but we also do extra workup to learn more about the patient, because we need to make sure that we leave no stone unturned as far as finding risk factors for stroke and the cause of stroke. The cause of stroke can fall into different arenas. So you can have a clot that originates in the heart and goes up to the brain and causes stroke, such as with atrial fibrillation. So if you have atrial fibrillation, make sure you want to get that treated with a blood thinner and be under the care of a cardiologist. You can have clots form for other reasons. I always like to put it as, that my patient's blood is misbehaving. It's clotting a little too well. People have coagulopathies, and then we can steer them in the right treatment arena to prevent having a stroke due to that reason. Atherosclerosis forms within blood vessels. This is the second bucket, and it can form in the vessels that lead to the brain and within the vessels that are in the brain. Irregardless of where they are, it affects the flow within the plumbing. We're back to the plumbing, and stroke being a disease of the plumbing. So we want to make sure that we're treating high cholesterol and keeping plaque burden down as much as possible. And then the last bucket is where At the very end of the line, those blood vessels that come off the heart, they're very big in size. They're still sizable when they go up into the head, and then they just branch out further to the end of the line. And by that point, they're pretty fragile. And if you have things like high blood pressure, high cholesterol, diabetes, and smoke, then it makes those vessels even more fragile. And the blood vessel can fail at that point, and that's a different kind of stroke called a small disease vessel stroke.
Gotcha. Is that more common, less common?
I find that they're all about as common.
Okay.
So that keeps our job interesting because we're always looking for the cause, finding it to land in one of those buckets, and treating the risk factors that most affect those disease processes that lead to stroke.
Mm-hmm. And when you talk about managing cholesterol and things, how important is it to make sure that you're keeping up on your medications and things like that? Because sometimes we fall into the trope of, oh, I feel fine, I don't need to fill that script, and I'm so good. But then it can become too late very quickly.
And unfortunately, I see that scenario play out too often because I've had people sit in, when I see patients in the stroke clinic and say, I felt fine, so I stopped taking my blood pressure medication. Mm-hmm. But then high blood pressure, #1 risk factor for stroke, and it's called the silent killer for a reason because your blood pressure can be going up and up and up and you can feel just fine, but then something happens like stroke. Mm-hmm. And like you said, it's too late.
And so stress management, of course, is also very important and something that we might feel like we can't control, but kind of setting boundaries and things, that's something we should take charge of.
Yeah, that's a really hard one. Everybody has stress, and I do talk about that with my patients because it affects blood pressure too. It raises your blood pressure, and it's really a good idea to have close contact with a primary care provider who can help you navigate that. And not to always say that another medication is the answer, but it might be, or counseling might be, or some distraction, or picking up some hobbies that distract you and get you relaxing and thinking in another arena and away from the stressor.
Mm-hmm. So when looking at stroke, I've typically thought of it as a condition that happens to maybe somewhat older patients. Is that the norm? Is there a wide range of who can be impacted? I
would say that you see more of the population of patients with stroke at an increased age. Okay. We consider, the literature states greater than 55 years of age and greater than 65 years of age. I've seen it in my reading, both numbers. Irregardless, when we start getting older, things start wearing out, and that's why it becomes a risk factor. Plus, if we have carried along high blood pressure, diabetes, high cholesterol along the way, that increases the risk. I've had patients that are 18 years old that have stroke. Mm-hmm. So not everybody that has stroke is older in age. I think my peers would agree with me that we see maybe more 40-year-olds than when I started 9 years ago. And I hope that's a trend that we can turn around through awareness like today.
Man, just to ask, and if you don't have a concrete answer, that's totally fine, but do you think there's a reason for that? Increased stress or more smoking, or?
Well, what else is going up? Stress, but diabetes. Diabetes numbers are not going down. And here in America, we have a lot of access to food. I tell my patients, this is America, we could all lose a few pounds. Mm-hmm. So sedentary lifestyle is a risk factor, a recognized risk factor for stroke. So staying active, eating a healthy diet, trying to stay at a healthy weight, lose a few pounds, those are all really important. And I think that those things do contribute. Smoking, vaping has picked up where smoking has tapered off, and I don't think that that's any better at all. I think that that's equally bad, if not worse. So that is certainly detrimental to your health. If you overuse alcohol or binge drink, that is a risk factor for stroke, and I still see that as an issue in our society.
Sure. So as you're coming from Carle is a certified stroke center, from what I understand. What does that mean to the average person?
Being a comprehensive stroke center is the highest designation that you can achieve in stroke care. Okay. And Carle Foundation is a comprehensive stroke center. We're able to provide any level of stroke care. We have neurointerventionalists that are a subspecialty within neurosurgery, and they're able to do amazing things to turn an acute stroke around for people that present with the criteria where they're able to meet and do that. We have other hospitals in our system. We have primary stroke centers, Carle Methodist in Peoria, Carle Broman in Normal, and they have their own designated stroke teams as well and are able to provide high-level emergency care for stroke patients. Our smaller hospitals, Carle Richland, Carle Eureka, Carle Hoopeston, are acute stroke ready hospitals, and they are at the ready to initiate acute stroke care when people present to their emergency departments and initiate transfer to a higher level of care.
Very well put. I feel like I should have been taking notes or had a map out, something like that. But it's nice to know that that level of care is making it into more rural areas.
Yes.
Have watched that develop over the last several years, which is really exciting. So as we're heading toward our last several minutes, is there anything about the prevention side, since that's what our episode's about, that I didn't quite ask about that you think is important to know that we didn't cover?
I think that we have covered all of the common risk factors for stroke, such as, and it's a good refresher, high blood pressure, high cholesterol, diabetes. These are all manageable risk factors for stroke, and staying in close contact with your primary care provider who manages and treats these risk factors is very important. Not smoking, that goes without saying. What we learn is that through symptoms, and I think it would be good to just go through the symptoms again with Be Fast, recognizing these brings patients to get checked out. Stroke is discovered, and then the workup is done to find out more about patients. So when someone has a balance difficulty or a coordination difficulty or a vision disturbance, double vision, not a lot of people know that double vision is suspicious for stroke. A lot of people do know that facial droop or arm weakness. I've had a lot of people say, I had mom hold up her arms and she did this. Or any weakness on one side of the body or the other, or any difficulty with speech where they're not able to repeat a sentence back or say it clearly, these are all very concerning for stroke. So patients come into the hospital, we do the workup, we find it on imaging after we've started our evaluation, and we look at heart function to make sure that heart function on echocardiogram, that the heart is good and strong. We look for things like atrial fibrillation, which is an irregular heart rhythm that can lead to stroke by clots forming in the heart. Yeah. And we take a look at that, plumbing those blood vessels to see if there's any plaque burden with them.
And so, again, in our last few minutes here, we have been diagnosed with a stroke, and I know that there is, again, a spectrum, very individualized, but what does life after stroke look like? Is maybe getting back to 100%? Is it that too optimistic? What can I do next?
Never too optimistic.
Okay.
So life after stroke, I always tell my patients therapy, therapy, therapy.
Yeah.
And like I said, at a minimum, stroke can kind of get in the way. It makes people feel tired when they have a brain injury. It makes people feel like they're in a mental fog. This with stroke doesn't last, which is a good thing. Okay. But through therapy, say they've got weakness on one side of the body, through therapy and getting that weakness and that coordination back, therapy is where that works. And people do get complete resolution of symptoms. Some don't. A lot do. Mm-hmm. And we always need to be looking to strive for that carrot, to get as much back as we can and get as much function back as we can, because unfortunately that's what stroke is good at, is taking things away through those symptoms, which can be found on our website at carle.org, where you can learn more about stroke and even test yourself on stroke symptoms.
And if I'm someone who's already had a stroke, am I at higher risk for future stroke?
Yes, you are, because you have cerebral vascular disease. So you know that you've had a stroke. Hopefully you've had a very good workup and you're treating all of your risk factors, and now you're on medications to help prevent stroke, such as just a baby aspirin is good medicine. Aspirin works really well, which is why we just need a small dose every day to have that continued therapeutic effect, to keep the blood just a little bit slick, to keep it going through that plumbing, those blood vessels. And there's a lot of other medications that work stronger than aspirin or prevent clots from forming in the blood, such as with atrial fibrillation. And of course, medications to treat high cholesterol, to keep plaque burden away from the inside of our vessels or down.
So there's a lot of moving parts here and about a minute or so left. Is there any other doctor's orders or anything I missed that you think is important for a viewer to know?
I think that it's important to know that when stroke happens, people can feel very anxious about a stroke happening again, but I emphasize that we know so much more and have a better plan moving forward versus ignoring a slight symptom that you push through and you still didn't get checked out and you don't know what your risk factors are, that you even had a stroke. So I always weigh heavy on, we know so much more now, we have a better plan now through all the care we've provided, and go live life.
So don't delay, be fast. And if you need more information, you can find that on Carle's website. And Lage, thank you so much for coming on Being Well. I sure appreciate it.
Thanks so much for having me.
Of course, and we hope our viewers enjoyed this episode, learned something, be fast, and I hope you'll join us for our next episode.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.